Thank you for the interview. I really appreciate the opportunity to ask you some questions about your work with adult entitled dependency. And I'd like to ask you sort of just to start with, in a nutshell, to describe adult entitled dependency, just to let us know what that is.
Yeah. Well, in its most general sense, the term adult entitled dependency refers to a form of interpersonal bondage that evolves between parents and their adult children.
Uh-huh.
In this bondage, the adult child, feels entitled or expresses entitlement to certain material and emotional services, provisions by the parent, and the parent accommodates to this entitlement by supplying those services. But it's not just any entitlement and accommodation, but an entitlement and an accommodation which hurt both the child and the parent's ability to function and cause considerable distress to at least one of them. Now, there are a few characteristics of adult entitled dependence which we can point out. Behaviorally, we notice on the child side we're talking about adult children. We're talking about young adults aged 20 to sometimes 50, not so young anymore, but
So
some of them.
the 50-year-old child.
50, yeah, and we call them adult children,
Yeah.
actually. And here are some behavioral characteristics of these children. They tend to blame their parents a lot, yet they cling to the family home and to their old rooms and refuse to leave the house. They are not in employment or academic training. They virtually have no social ties. They reverse the day and night cycle. They many times they socially withdraw from their environment, never leaving the house and occasionally not even leaving their own room for long periods of time. They may be actively or passively aggressive towards their parents, occasionally even what we might call terroristic towards their parents, and many times adult entitled dependence goes together with suicidal themes, suicidal threats.
And
Parents, yeah.
And I'm going to ask you about that in a little while, because that's a really, to my mind, a very key issue.
Mm-hmm.
Yeah.
Parents to adult entitled children also have certain characteristic behaviors. They live in relative isolation from their social environment. Their contact with friends and family relatives decreases with time. They tend to submit to the adult child's entitled demands, and occasionally they try to break the cycle, and then they get punished or negatively reinforced by the child back into the old position of giving in. They have the fantasy of changing the child. They suffer a lot of distress, sleep problems, marital problems, anxiety. These are some of their behavioral characteristics. Emotionally speaking, parents of this form of bondage is made up of helplessness, blame and threat on the child's part, and that corresponds to another triangle, the parental emotional triangle of guilt, fear, and pity.
Yeah.
So, and together, these two triangles interlock to form a very chronic and inert form of emotional bondage, which can last for years. Because the more helpless the child feels, the more pity I have for the child, the more helpless the child becomes yet again. Or the more blame the child has, the more guilt the parent feels, and vice versa.
So
or the greater the threat by the child, the greater the fear by the parent, and vice versa.
So it sounds like an ongoing, self-perpetuating vicious cycle.
It is, and this cycle can last for decades.
Yeah. I was just thinking of the term that we use in the UK for adolescents and young adults in a similar situation, the term NEETs, which stands for not in education, employment, or training. But that term sort of locates it within the individual young person, whereas this very powerful metaphor of bondage that you use seems to me to locate the difficulty much more within the relationship and give it a systemic perspective.
I very much agree. Almost every culture in the developed countries has some form of slang term for these young people.
Yeah.
I think in Germany they're called Mama Hotel,
Yeah.
and in Japan slightly different, but also in the same territory they're called Hikikomori.
Yeah.
They have various nicknames in various cultures, but when observed in our approach, we view these individual characteristics or derogatory terms in a systemic context
Yeah.
to highlight the fact that these are what should really be looked at, and also intervene is the interactions between, or the interaction patterns between these young people and their environment.
And to help them move beyond that. I was just wondering how, and I don't think we've spoken about this before, how did the idea arise that it's necessary but also possible to draw on methods and the underlying principles of NVR in working to help families with this problem?
Well, thinking about the problem of accommodation, which, as we said, is a form of parental care which impedes development, the individual child's development, the parent's development, the family life cycle development. Stop the accommodation, trying to stop the accommodation is destabilizing the family system. If you stop providing laundry services or money to a 25-year-old adult dependent child, and you do that abruptly, you do that or even think about it, that will necessarily result in some form of distress. It will be a crisis, and adult children in this situation tend to become violent or very victimized as a result of any attempt to change their situation.
Yeah.
On the other hand, it's absolutely evident that in order to achieve change in such systems, parents must struggle. They must struggle to de-accommodate. They must struggle to reassert their own rights to live and conduct their lives at home. And there is no way that this can be done without a struggle. And at this point, NVR, nonviolent resistance, Chaim Omer's nonviolent resistance approach becomes relevant as it becomes relevant in all other interpersonal situations we know which require struggle as a form of change and also therapeutic change. Yeah. So that's the connection. You cannot stop providing these emotional and material services without inviting some form of conflict. Yeah. And you need to know how to manage this conflict. And NVR provides us a very powerful set of tools for conflict management, yeah. Non-escalating conflict management.
Yeah. And I mean, I don't know of any other psychological approach that has been developed specifically to deal with this problem. So I feel that you've been doing some really groundbreaking and pioneering work. And I just wonder, in the development of using NVR for adult entitled dependency, what do you feel are the sort of most significant understandings or insights that you've developed?
Our work has brought us many insights. The first one that comes to my mind is that what we view today as symptoms of many mental disorders always exist within an interpersonal context, and that in many cases, when caretakers cope with people in some form of chronic mental distress, the entitled dependence dimension of this interaction is necessary in order to understand the symptom and to cope with the symptom. The symptoms are always in a social context. They are always in an interpersonal context. And many times they are in an entitled dependence context. And many times it's not enough just to individually treat someone. So our work with entitled dependence or adult children has taught us that. For instance, young adults with severe OCD, we fully be treated without also intervening in the way they interact with their caretakers and the way in which their caretakers accommodate to their rituals and demands. So this is probably, to me, a very central insight.
I guess, I mean, Dan, you've just made a connection between the entitled dependency and the interaction patterns that maintain it, I guess, and mental health symptoms. And you've sort of located mental health symptoms within the relationship. You know, you've added that aspect to the symptom. So I was just wondering, you know, how do you see the usefulness of NVR for adult entitled dependency in helping families in which the younger adult struggles with what are called severe and enduring mental health problems?
To answer your question, and also at the same time offer another answer to your previous question. We have Chaim and I had a very fruitful encounter with a psychiatrist called Joseph Zohar, who is a worldwide authority on OCD.
Chaim Omer, just wanted to,
Yeah,
for our listeners.
We had a very positive and fruitful encounter with Professor Joseph Zohar, and we worked in his psychiatric ward, treating the families of his patients in parallel to his work with the patients. And the way he defined it is that entitled dependence is a kind of a dark undercurrent that crosses horizontally the various vertical silos of diagnosis, so of individual diagnosis. And that this dark undercurrent has not yet been understood or conceptualized, and no interventions have yet been developed for this dark undercurrent. But because usually, when you see it in psychiatric wards, patients tend to be very, very dependent towards their caretakers.
Yeah.
But that's usually considered a form of noise, a form of a nuisance that just needs to be overcome in order to treat the individual patient. And our approach is to begin looking at this noise, at this background noise, as the figure, as the foreground, and try to understand how dependence intimately interacts with what we today call a mental disorder.
Yeah.
It is part of the social aspect and construction of this mental disorder.
So, I mean, what you've just said sort of reminds me of the way that very much of adult mental health service provision in this country, in the United Kingdom, excludes parents. Often when parents wish to speak to professionals, they're told that the professionals cannot or will not speak with them because the patient is an adult and therefore autonomous. So it's assuming an autonomy, it seems to me, that isn't really there at all. I mean, in a similar vein, I wanted to ask you I work with families with adolescents or children in the main. And one of the difficulties that come up a lot are older adolescents who are socially self-isolating, many of whom are on the autism spectrum. And I also see families where that moves on into young adulthood, where the social self-isolation of young people on the autism spectrum becomes even more severe and often debilitating. And I wondered, particularly for this sort of client group, what possibilities does this approach open up in your experience?
Based on our practical experience, we have dealt with several cases of autism, sometimes undiagnosed or hitherto undiagnosed, and sometimes diagnosed. And we managed to use NVR in order to break the walls of isolation in which an autistic child has managed to engulf himself, using the entire family as a kind of an insulation material to set his world apart and somehow protect it. And practically, we managed to help families in this situation. We have not yet began the important theoretical work of perhaps understanding more how entitled dependence can exacerbate autistic symptoms. Exactly, or what mechanisms, how it works. We have not modeled it, but practically speaking, our regular interventions have proven to also be effective with families with autistic children.
Now, I mean, that's very hopeful, because I think many families initially experience a diagnosis of autism spectrum as helpful, because they can suddenly understand what's going on, and people want understandings. But often, as time moves on, that can become like a lead weight, because people lose hope. And I think what you're saying really gives hope to families. So I really welcome that.
I agree, and we really saw the difference we can make in lives of certain families where all hope was lost for decades.
Dan, one really useful thing I've learned from you is that suicide threat and risk occur in many or maybe most cases of adult, or in my work, adolescent entitled dependency. And that the impact on parents is often devastating. And since I've learned that, I've asked much more specifically, and I hear more about not just the existence of the suicide threat, but the effects within the relationship and and how it constitutes part of the relational patterns. What do you do to reduce or to manage risk where this is so prevalent?
The first thing we do is try to model or have some kind of idea on the meaning and function of suicidal threats in the entitled dependent situation. You see, entitled dependence is a kind of a bubble. It is composed of a parent and a child who rely on some very deep assumptions and agree on them. And the assumptions are, one, that the child cannot function autonomously because he or she has a problem. And the second assumption is that it is the parent's total responsibility to maintain the child, to support this child's life. Entitled dependence is a very existential situation. It's the parent sustaining the child's existence. And another feature of this bondage is that the longer it goes on, the more both parent and child lose sight of all alternatives. So entitled dependence is a situation with no alternative. A situation with no alternative is a situation where to which the only alternative is death. It's a very existential state. And that is why suicidal themes are prevalent in each and every, in most cases we meet. And it is not just, and you are right by saying or by asking about risk, because these situations are indeed risky, And the interventions also carry a certain degree of risk because you destabilize a situation which has become very, very inert for a long time. So we take extra care when we initiate our interventions to assess what kind of risk are we talking about here. We do that by trying to meet the identified patients, the adult child himself, and we very much push for this child to be psychiatrically diagnosed before we take any action or begin the actual intervention. We really want to know what we're up against. We also, in case the child does not cooperate, because our intervention can also be initiated without the adult child's cooperation. That's one of the advantages of working with the NVR paradigm. So if we don't have the adult child, we involve a psychiatrist anyway. Just we create a kind of evaluation by proxy. We provide some working assumptions. They would be perhaps less exact, but still they are better than no assumptions regarding the child's state of risk. So we do many things to try and calculate and mitigate the risks in our work.
And I know I was just, as I was listening to you saying this, I was just thinking of a case in which I provided a consultation a while back. And the NVR practitioner was faced with an older adolescent young woman's suicide threat. And where I felt there was an impasse was that in that she thought that she's not expert enough to deal with it. So she handed it over to the GP. And I was surprised that she felt that the GP would be more expert in dealing with suicide risk than this systemic family therapist and trained social worker. And the GP made a referral to a psychiatrist, and the psychiatrist said to the young woman, "And if you make another suicide threat, you will go inpatient, whether you want to or not." And I felt that actually that had been quite a dangerous intervention because she was told, in essence, to go underground. I felt it would have been much more useful for my colleague to remain involved also in dealing with the suicide risk. So she got herself involved again, and they organized a suicide watch for as long as the risk level was deemed high. And it became a very, very lovely response because the young woman really felt looked after and cared for and reconnected with the support network around the family. And actually, suicide threat by her then went down a lot as a result of that. And it just seems to me that NVR itself and the methods in NVR offer some really helpful tools for risk management in suicidal or parasuicidal behavior in that way.
I think your story contains, in a nutshell, the approach we have developed to suicide threat interventions. We find that the suicide threat. But by the way, your practitioner who referred to the GP, we can absolutely understand her. Suicide threats are threatening.
Yeah.
Actually, when Chaim Omer and myself wrote the paper on suicide threats, we found only 8 papers in the behavioral science databases, journal databases, that have suicide threat in their titles. It's almost a taboo subject. It is very, very frightening and menacing.
Yeah.
Suicide threats are threatening. So the suicide threat is it mixes up something in the relationship between the child and the parent, and the relationship between the child and both.
Yeah.
Am I loved or not?
Yeah.
That's completely mixed up with the question to be or not to be. Am I loved by my parents? Am I important to my parents? Will my parents protect me from life?
Yeah.
Become identical to the question, is this life worth living?
Yeah.
And what we do is, when we hear a suicide threat by an adult child, we let everybody know around him, all the people who love him, that he has made a threat. And in this way, we convey a message to the child that to be or not to be is a question between you and everybody and everything. It's not between you and the parents.
Yeah.
At the same time, we lift a very heavy burden of impossible responsibility from the parents' shoulders.
So this is not just your parents' business, it is the entire community's business.
Which actually coincides with a very prevalent motto today in suicide intervention, which is suicide is everybody's business. You must have heard that.
I haven't actually, but
okay. Many suicide prevention programs today use this motto, and I think justly so. Suicide is everybody's business. It's something that should be dealt with and coped with by groups of people, practitioners, relatives, friends, social networks. It should never be a secret, and it should never be coped just by the parents.
So really those 2 principles that are at the basis of NVR, that we act against secrecy, and that we grow a supportive network, they really come to bear here.
Yes, to which I would also add another very, very important principle, and that is the understanding that I cannot really control or change another person's behavior.
Yes.
And I think these are perhaps, in certain cases where suicide is very dominant as a thing, and also as a behavior or a risk, that I think the climax of the intervention is the moment that we sit with the parents and we manage to realize together, the therapist and the parents, that the parents have reached the very utmost limit of their ability to help the child or keep the child alive.
Yeah.
And beyond this point is the child's decision or business.
Yeah.
And then all we can do is just remain where we are on that very outer limit of our abilities to act. And be with the child, never, never abandon him or her, but at the same time not being able to go one step further.
Yeah.
And that is a very, very difficult thing to do, a very difficult position to take, but also a very profound one.
Yes.
It really sometimes changes the balance, and I think that all in all, it has a protective and preventive potential for the risk situation.
And I think,
yeah.
I think this is a very, very important message for all practitioners who work in, whether it's in adult mental health or in child and adolescent mental health with suicide risk. I think they need to hear that message. Particularly those practitioners who would still wish to maintain patient confidentiality rather than working with negotiated confidentiality, and who would wish to keep risk, threat of risk, communication around risk, who would wish to keep all that private.
We consider these things actually risk enhancing.
Yeah. Yeah. Dan, I guess from a professional point of view, I mean, my understanding is that NVR for adult entitled dependency often works the best if there's a multidisciplinary team with the NVR practitioner at its core. And I was wondering why this may be the case and how it works.
Well, it really depends on the severity and complexity of the case.
Mm-hmm.
Severe and complex the case is, the more we would involve, we would tend to involve or build a team of mixed capabilities.
Right.
To begin with, even before we consider the complexity and severity, our intervention which we practice should preferably be practiced within a team. It's teamwork. It's teamwork beyond the various skills needed. These are tough, difficult situations. These are risky situations. Adult-child problems are much more severe and risky than little kid problems. So working in teams is paramount. And since we developed our intervention in the private sector, so it's much harder to maintain a team environment for our cases. But we have no doubt that a team environment is what should be for that purpose. Then we have the various specific professional needs or expert needs of a particular case. And this is where severity and complexity come into the picture. The NVR practitioner serves as the case manager and also many times as the systemic meeting point or the systemic point of entry into the case. He sees things from above, or he sees the big picture, the big relational picture. But then certain members of the family system may need individual therapy that could help them. if you have an adult child with an extremely anxious dad or mom, and one of this anxious person, this anxious parent, could use therapy to lower the intensity of his anxieties, that could really drive the case forward. Or in high-risk cases, or in cases where we have a diagnosed mental disorder, or we suspect that there is an undiagnosed mental disorder, we would involve a psychiatrist. We would involve a rehabilitation expert to begin plotting the adult child's return to some form of functioning after years of being of doing nothing, basically.
So in a way, the offer of support, whether it's psychotherapeutic support, whether it's cognitive behavioral therapy, whether it's occupational therapy or whatever that might be, becomes part of the NVR intervention.
Absolutely.
It's hand in glove.
Absolutely. I really think of NVR as a sort of a hub.
As a hub.
Hub.
Yeah.
Yeah. An interdisciplinary hub that brings together psychiatry, social work, rehabilitation expertise, clinical psychology, family therapy, cognitive behavioral therapy, into a working structure, which can be very powerful. And we use all these. We recruit and enlist all these different professions, sometimes in our cases, working as a team.
It's strange sort of noting one's own responses. As I was listening to you, I think, putting myself in the shoes of the younger adult who's developed entitled dependency. And there was something about what you said and the way you just said it that was very reassuring.
What way?
I just sort of felt, okay, I'm jumping into cold water and I don't know the currents, and it's scary. But there are people there who, whilst encouraging me and actually expecting me to take that plunge, will be there in the water with me.
You're talking as a therapist or as an adult child?
I was imagining as the adult child. I won't just be thrust into the water. I will be shown how to swim.
Getting to that position requires work.
Yeah. No, I really appreciate that. But I just wanted to sort of highlight how there is a really reassuring element in that teamwork approach.
It's the reassuring element is first and foremost for the therapist.
Aha.
And the more reassured the therapist is, the more confidence he can instill in the clients.
And perhaps it can lead to a spread of confidence through the system.
Then he can convey that confidence to the parents, who can ultimately convey it and find the strength to resist their child's entitled demands in a non-escalatory manner.
Yeah. There's something very lovely about the support network that the therapist is part of, which can help enhance the confidence of parents in their support network, which perhaps can enhance the confidence of the younger adult eventually. I was wondering, what has moved you personally the most in your work with AED?
In a nutshell, it's the ability to reinstill hope in parents and then use this hope to change things which they never thought can change. Seeing an adult child who has been sitting in a room for 5 years or even 10 years, wasting his life away, turning night into day, addicted to some form of digital game or social network. Watching this young person go out of the room and into adult life is very rewarding. Very rewarding. And watching these parents regain their sense of confidence, identity, focus on their own lives and on their own stage of development. Many such parents are over 50. We're going into some other phase of life. I find that very rewarding and very exciting. Yeah.